September is Vascular Disease Awareness Month, a disease that affects arteries, veins, and lymphatics. I'm joined now live by Dr. William Tung, who's a vascular surgeon at UPMC. Thanks so much for being here.
Thanks for having me.
Why does this affect so many systems in the body?
It's a diffuse medical process. It's a diffuse medical disease that affects arteries everywhere. They're more clinically important in some areas than others.
What causes vascular disease?
Well, it's the buildup of atherosclerotic plaque. There are multiple contributing risk factors, including smoking, diabetes, hypertension, high cholesterol. Very common problems in our society.
How common?
Well, it's I don't have a number for you, but
I mean the disease. How common is it?
the disease is pretty common. I mean, it's what we see. It's what we spend a lot of the bulk of our time on as vascular surgeons. It's a major public health issue.
What are some of the symptoms?
Well, as far as lower extremity disease, the earliest symptom is pain with walking. And as it progresses, people can have pain at rest, discoloration, ulcerations. The more commonly affected people have the lesser stages of the disease.
So how do you know if you have vascular disease? What do you do to determine, to make a diagnosis?
It's pretty old school. The major things are history and physical, examining the pulses and asking questions about these symptoms. And then there are non-invasive studies that are offered with screening where they measure the pressures in the legs or do ultrasound.
My understanding is there's a lot of confusion that it may be the same as heart disease, but that's not true?
Well, vascular disease and heart disease have overlapping patient populations. They have overlapping risk factors and causative factors, but heart disease is diseases of the coronary arteries in the heart, and vascular disease is elsewhere. For example, the lower extremities or the carotid arteries. So clinically, they're different diseases and they're treated differently.
Is vascular disease more common in older people?
Yes, we see it in younger people, but it's definitely more common as people accumulate more disease and more damage through the years.
What kind of treatments do you use?
Well, we offer treatment using minimally invasive percutaneous methods and open surgery and a combination of both. Although the initial treatment and the most important treatment is conservative. It's medication, smoking cessation, healthy lifestyle, exercise. Those are the most important things to start with, for sure.
What do you recommend if someone thinks they may have this?
They quit smoking. They see their primary care doctor for risk factor modification. They exercise, and then a referral to a vascular specialist for follow up and further testing as needed.
Have you found there's an increase of it?
An increase of it?
Of the disease?
I don't know that there's been an increase, but it's something that's always there. I mean, the risk factors are hard to eliminate. And as people get older, we see it in later stages as they live longer.
Well, thank you, Dr. Tung. We appreciate your being here and giving us some advice on this.
Thank you very much.